A lot of people think that home health and home care are the same thing, but they definitely serve a lot of different needs. Some people also confuse the two of them and aren't sure which is which. If you're choosing the wrong one, then your loved one might not be getting the support that they actually need. In this video, I'll break it down clearly, the difference between home health and home care, so that you can make the right choice. You don't have to do this alone. Check out my other videos if you want real advice about navigating home health and home care choices. Question 1. What is home care? Home care is non-medical care provided in your loved one's home. So home care is going to be what you commonly would refer to as a caregiver. It's the day-to-day support of your loved one in their home. This could be dressing, grooming, bathing, doing light housekeeping, load of laundry, cleaning up after meals, things like that. Just the day-to-day activities that keep your loved one comfortable and safe. Now, caregivers are trained as home health aides, but they are not nurses, PTs, or doctors. The schedule could be very flexible. It's meant to be adapted around your needs, and it is there for when you need it because you aren't physically able to be there to care for the loved one yourself. That can range from just a few hours a week to cover you while you go to work or grocery shopping, or all the way up to 24/7 care. So what is home health then? Home health is skilled care performed by a nurse, physical therapist, occupational therapist, speech therapist. These are all medically trained professionals, and they're going to be performing various services in your home. This could be dressing changes for wounds, physical rehabilitation, IV infusions, peg tube changing, ostomy bags, things like that. Things that you would need a nurse or a physical therapist for. That's what home health is. And again, this does take place in your home, but it constitutes as skilled rehabilitative services. Home health can also include occupational therapy and speech therapy. Those are also the common disciplines that you would find in home health. What is the difference between home care and home health? Home care is short or long term, depending on what you need. It can be ordered at any time. You don't need a referral. It's usually paid for by you, and it's non-medical in nature. Now, home health is medically focused, has to be ordered by a doctor, and all services are performed by a licensed medical professional. Okay, next question. When should you choose home care? Well, simply put, are you looking for somebody to be with your loved one while you're not able to provide care for them? Is it more along the lines of, hey, I have to go to work and I don't have anybody to sit with my mom or dad? Then you're looking at home care. If you need companionship, if you need help getting dressed in the morning, if you need somebody to help you with some light housekeeping because you can't do it yourself or for your loved one, that's all home care. When should you choose home health? Usually you know when you need home health. You've had a major surgery like a knee replacement or a hip replacement and you're coming home from that. You've had a fall and you were hospitalized, sent to the rehab center, and now you're coming home again. These are all areas where you would choose home health. Home care would be day-to-day tasks. Home health would be major medical tasks. So a big question that I commonly get is, can I use both services together? And the answer is absolutely. In fact, it's pretty common. Let's say that you get a knee replacement and you live alone. Well, in the home health sense, a nurse and a physical therapist are going to come in. The nurse for wound care and the physical therapist for your rehabilitative care. But you would still need a caregiver to help you with the personal tasks. That's where home care would come in. They're going to help you with bathing, grooming, dressing, light housekeeping, whatever you need to keep you comfortable and safe in the interim. That's a perfect example to me of when you would use both services. Choosing the right care for a loved one can definitely be confusing, but knowing the difference between home care and home health is a great start. You're not alone in this. We're here to help.